Welcome to another edition of the Dementia Care Partner Talk Show. Now, here's dementia care expert Teepa and your host, Greg Phelps.
Hello and welcome to the Dementia Care Partner podcast series. Teepa, our topic today is a little bit prickly. It's families and dementia. Here's the scenario. I live in the same city as my dad, noticed a real change in the past few months. When I try and bring this up with my sister, she says, Dad's fine. I talked to him on the home phone and he's sharp as a tack. Is my sister in denial or am I missing something? Why is it important for families to try and get on the same page?
Yeah.
Boy, I threw it all at you at once, didn't I?
Wow. Yeah, I was going to say, well, that is probably one of the most common scenarios we hear about because your experience with your dad and your sister's experience with your dad are two different experiences. And the tricky part is, well, you may be actually spending time physically with your dad or trying to help him do some things, whereas your sister's having little conversations on the phone where dad is quite capable of having a decent conversation on the phone. And she hasn't realized how little she's asking of him, or he actually treats her differently, but he always has. And so we have family dynamics that enter in, and we have ways of interacting that enter in. And we may also have that she really doesn't notice things. I mean, that's part of it, could be her. She doesn't pick up on things, or maybe you're hyper vigilant. So before we start assigning blame, I think you said the other part, which is critical, is how important it is for families to figure out whether they can get on the same page or not.
So I threw a whole bunch of stuff at you all at once, and there's no easy answer, is basically what you're going to give back to me. I can tell that. So let's examine my relationship, and then let's examine my sister's relationship. Why is he able to communicate with her, and yet when I go over there and tell him that he has to go to the doctor or he has to do this or something like that, why do I get such a negative reaction, yet he's all lovey-dovey with her?
Yeah. Well, it sounds like you have a tendency, and you may have gotten it from your dad, to tell him what he ought to do rather than seek to engage with him more like a partner. So, what I heard you saying is, I tell him what he needs to go do this. I go over there and tell him what to do. I'm wondering whether your sister's conversation sounds a little bit different. And she's
Well, she's not dealing with him every day, and I know what needs to be done. I know he's got a doctor's appointment. I know we got to, these.
Absolutely. You know a lot of things she doesn't, and you're trying to do a lot of things she isn't. So I'm wondering whether your needs to interact with your dad are different than your sister's needs.
Yeah, I got to get business done, and she just phones up and chit chats.
Yeah. So is she in town too, or is she somewhere else?
No, she's somewhere else. She's out on the East Coast.
Okay. So how important is it that you get your dad to the appointments?
Well, I mean, you can't get a doctor's appointment too easy these days. Pretty important.
Yeah. So how important might it be for you to develop some new skill sets if you want to be successful with your dad?
Well, why do I have to develop them? He's the one with the problem.
Yeah, well, with dementia, we don't have a cure, we don't have a fix. So if we don't try something different in our interactions, it sounds like historically you got along okay with your dad.
Generally, yeah.
When did this start up? Just out of curiosity.
Oh, this is about 3 years ago, and it just keeps getting worse and worse and worse.
Yeah. So you're describing a typical pattern where one sibling has a greater responsibility for getting things done on a regular basis than the other one. And what starts to happen is that sibling who has greater responsibility wants the other person to see it their way, just like they want dad to see it their way, which is they're just trying to help. And maybe what might be more helpful is, how do I figure out how to help dad, and how do I let go of the idea that my sister's going to get what I get until she has trouble having conversations with him on the phone.
So I could bristle and say, why do I have to change and she doesn't? I could.
You could, and you might, but
probably wouldn't help much, would it?
Probably won't make a difference. It doesn't sound like it's helping that much with your dad. I mean, I suspect you're a little bristly with him because you set the appointment up. You're a little frustrated because it's hard to get those appointments. So I'm wondering whether learning a couple of things that might make it a little easier to get him to the appointments might be helpful.
Well, yeah, well, anybody that can make my life a little easier, I'd probably listen to them.
Okay, and so is that gonna be your sister?
No, no, I don't think
Mm.
she's going to tell me a whole bunch that's going to make things easier. She seems to be in denial that he's anything wrong with him.
Yeah, she's not experiencing what you're experiencing at all, and
No.
we aren't gonna spend a lot of energy with her right now. I'm thinking what we're gonna do is spend some energy with you. What do you think?
Well, I'm willing to try anything if it makes it a little easier. I'm tired of the fighting.
Okay, so what I can tell you is we do free half-hour consults.
Free. Oh, okay.
Yeah. And then we have some Ask Teepa Anythings in some evenings once a month. So we can do some things in that session too. Or we could do problem solving with PAC, which is a new session we've added in once a month, where we do some problem solving ahead of time and then have the person sort of share out a bit about what's been happening.
Are there people locally that I can talk to, or is that just sort of, or
Well,
I
that's
guess with
sometimes.
the internet these days, you might as well be local.
Well, you could sort of seek someone locally. You might check around and see what's available locally. We have people who are active in PAC, independent people who are all about different parts of the world. But we also have things available online with people who are a little more trained and a little more skilled to be consultants or responders or seekers with you to help you figure things out a bit.
So just can you tell me why is it that he treats us different? I'm just that my brain just can't really let go of that.
Yeah. So when you were growing up, did he treat you and your sister exactly the same
No,
back?
no, no. She was the apple of his eye. So
Oh, and who's making the demands that something happen that he's not maybe as used to?
yeah, probably me, huh?
Yeah. So I wonder if it's time to let go of the idea that this is brand new and accept, well, this has been a pattern, but boy, is it exaggerated now.
Got a video on that one?
A little bit. Yeah, we actually do. Because it's such a common pattern. It's so hard to not want what you used to have when you can't have it. But you've changed places. You've switched roles a bit. You didn't used to tell your dad when to go to the doctor and that he needed to get going, and maybe how you're telling him might be contributing to that sense of he doesn't like you as much as he likes your sister, but it could be something beyond that. So it
Okay.
might be worth
So
exploring.
I'll commit to trying my part. What can I do about my sister? Can I tell her to watch the videos?
You could try. More than likely, she's going to say, I just don't see it. And it's like, wow, okay. Wow, we're sure seeing things differently. I hate that I feel so alone. Because when you talk to dad, it seems like he and you are getting along just fine. And when I'm trying to do the things that it's been recommended we do, I feel like I'm taking the heat. Would you be willing to take a look at this video that they recommend? Because I do think something might be happening, but I don't think it's bothering you and dad's relationship. But boy, am I running into it.
So I may be able to get her on side and maybe she could actually help me.
Yeah, because maybe if you didn't see it as she's in denial, but rather what she's experiencing is not what you're experiencing. I mean, for one reason or another, and decide to figure out how to maybe let go of that part and focus in on what do you want from her? What is it you're really seeking?
So Teepa, I just have to ask you one more question. I know you're a busy lady, but one more question. When I talk to Dad, I get 2 and 3 word answers. That's about it. Yet he chats away like a magpie to my sister. How can he do that?
Well, it may be a combination of you, your sister, and your dad. So one of the things is social chit chat is often a very preserved skill. So if she basically sets him up and he responds, it feels like, wow, look at them go. Whereas you're coming into the situation with an agenda. Your agenda is, hey, dad, do you want to go ahead and get your coat on? Because we need to go. It's like, well, where do we need to go? To the doctor's. Well, this is the first time you brought it up. No, it isn't, Dad. I told you the other day. And what, without intending to, rather than a chit chat, you've started an argument. It's another
Hmm.
way to go back and forth, but I'm not sure it's what you're looking for.
Well, so I will work on my skills.
Well, that might help. Let me just say that. I'm not sure it's going to solve all the problems, but I think it might help because you might be able to build skill, but also recognize what does he still have left? Because it seems like your sister has got that one down a little bit.
Teepa, we spent a little bit of time on that scenario and that problem because, as you have said, it is so common
Mm.
and people are so desperate for help and it affects the family dynamic so much. It's important to examine this. You said you have videos and other things. Run through that list of resources for our listeners again.
Yeah. So one is a free consult, half hour free consult. Another is free YouTubes where you can sort of see why this might be going on by taking a look at some of our YouTubes where we show it's like one person has a totally different interaction with someone. And we have webinars, we have the journal. All of those are free resources. And we have live chat. So you can go on and you can ask a question chat wise, and somebody will respond to you.
And you do have also some paid consultants, I believe.
We do. We have paid consultations. We have a care partner support series, which is a 5-part series, and it's pretty inexpensive. And it gives you 5 sessions to meet other people and to feel supported and to learn something about this thing, this journey you're on. Um, and we have other webinars and resources, written and video and interactive. We got a lot.
You certainly do. Teepa, thank you once again.
You're welcome, Greg.
You've been listening to the Dementia Care Partner Podcast Series.